information that we are sharing today is our own personal experiences and does not constitute as medical advice. Please check with your doctor for medical advice that is suited to you and your condition. Thank you. Hello, everyone, and welcome back to Take a Pain Check. Today, we have a little bit of a different perspective when it comes to JIA. Lori was diagnosed with JIA as a child and took an interest in patient care and patient research. Now, she is the advisory partner in her successful research project in the JIA option map alongside her partner in crime, Corrine, at the Choice Research Lab in Ottawa.
It is truly amazing to see what Dr. Corrine has done with her research for patients with JIA. Often on our podcast, we have patients that have JIA or people that are in a relationship with others that have JIA. But today we want to take a moment to talk about a researcher who has interactions with people with JIA and focuses her research project on people with JIA.
Yeah, sure. I'll go first. So my name's Lori Prue. Yeah, I mean, I was diagnosed with juvenile idiopathic arthritis, or back then it was called juvenile rheumatoid arthritis, when I was 14, from a small little town in Eastern Ontario. So spent a lot of my adolescence and my teenage years, doing the trek back and forth from this little town to Ottawa once I was, officially at the Children's Hospital and that sort of thing. And yeah, eventually I ended up getting involved with a patient organization called the Canadian Arthritis Patient Alliance. And it's from there that I got involved and I met Kedin and I got involved in a lot of different research projects as a patient partner, sort of bringing my lived experience with JIA and as a young adult and, growing up, seeing it all, as someone with inflammatory arthritis. So yeah, and that sort of led to my collaboration with Kedin.
I'm Karine Toupin-April. I'm a scientist and a professor at the University of Ottawa. So I trained as an occupational therapist, and then I did a PhD in public health and epidemiology and a postdoc in Ottawa here. And so I started to do research in juvenile idiopathic arthritis, probably close to like 20 years ago. That's crazy. So I got involved a lot with the Canadian Arthritis Network when I was a master's student. And that's what kind of started this adventure of doing some research on juvenile arthritis.
Do you have like a personal connection to juvenile arthritis?
I have asthma. So since I was like a newborn, since I was 6 months old, I've had asthma. So I always felt that, asthma and juvenile arthritis have some similarities. So there's a lot of projects that I did in juvenile arthritis. And I was like, well, I'm pretty sure in asthma, people would say similar things. So I guess it's my connection as a patient, first and foremost, that kind of led me to this work. And it's by chance that I did research on juvenile arthritis because there was a really good supervisor and she was really nice. And she said, oh, I have, projects on juvenile arthritis. And I was like, what is that? What is juvenile arthritis? I didn't know you could be a kid and have arthritis, right? And so that's what started it. And I just felt it's such a complex condition and it influences the lives of, young people who have it. And I just felt really that it was like a really important topic.
Totally agree with that. It is a really important topic. And Lori, as you mentioned, you were diagnosed younger. So what joints were affected at that time and what joints are affected right now as you kind of grew older? Did that change?
Yeah, definitely. I mean, at first it's kind of strange, it started in my hips and honestly, like my hips are probably less affected now, but it started then. I used to be a competitive dancer. So I had to, bow out of a few competitions and we didn't know what it was. We thought it maybe was an injury. And so it took a while. Like I think it probably took about a year to get like an official diagnosis. And then unfortunately, I was referred to an adult rheumatologist. And I think sometimes this can happen when you're like at this in-between age. It's like, oh, you're just a small adult, but you're actually not. And so yeah, then it sort of evolved into, of course, many different joints. Then it was more prototypical, the rheumatoid flavor, of arthritis with my hands and my wrists. Um, my feet as well. And so it affected me a lot in the beginning because I was, and I think Natasha, you study music as well. So with me, I played the piano quite seriously. Like I was probably in grade 9 piano, with the Royal Conservatory when I was diagnosed. And so it was really hard to then have such difficulty playing the piano and having to kind of I think I would have pursued music as a career. So then, having it affect my hands so much at such an early point, had to switch gears. And on one hand, I like to think, well, at least I was able to adapt and there was time to adapt and change career paths. Some adults don't have that benefit, but yeah, it was hard during those times, but it has sort of spread to like all over the place. So I ended up with arthritis in my neck, my spine. So yeah, I think it's pretty much like what joints aren't affected is more the question. So
you didn't really have a transition to adult rheumatology. You were kind of already thrown into that.
Well, it's funny. I ended up finding out about the Children's Hospital here in Ottawa. And so then I sort of started in adult rheumatology. I went to pediatric, and then I actually transitioned to adult later because I really wasn't doing well. So I was 19 or 20 when I made the official transition from pediatrics to adults. And I'm really glad to see I'm really happy I had the experience in pediatrics because it really showed me how to bring all these different care providers together because they did it for me, right? They held my hand and, would have me see an OT, have me see a physiotherapist. If I needed to see someone else, they'd arrange that as well. And so I think that set like a good role model for then how I try to manage my care now because it's as an adult you're on your own, unfortunately. And so you have to coordinate it and access OT and access all these people, and you need to manage it. So
I haven't transitioned yet, so I'm hoping it takes a while till I transition because everyone's been giving me very bad stories on transition, and I don't want to experience that. So I'm just waiting. And I know you mentioned that you're also a mother and you do have kids. Is it hard to be a mom and have JIA? And also, how old are your kids? Because we'd love to know that.
yeah, so no, I have two kids. My daughter Claire is 14 and my son is 8. Charlie is his name. It was definitely challenging. I think I had more trepidation about it actually before having them, and but then it's funny, as a parent living with JIA, and of course I had like a significant amount of joint damage, right? Like I also grew up in a different time. I always like to preface that I only was able to access a biologic by my early 20s. That option didn't even exist, when I was diagnosed. So I do think outcomes are, there's so many more options than there were for me. So I had quite a bit of joint damage, but it's funny, like I find I adapted to parenthood just like I had learned to adapt to everything, whether it was school, whether it was getting in, a job and working. And so really and I like to think that that's sort of like our superpower as people with arthritis, that we've really just had to adapt our lives to the world around us, right? Because it's not adapted to us. And so a lot of those same skills played into things, and I found it was hard, there's no doubt, but that sort of inspired me because I found it was really hard to find information, whether it be on medications that are safe during pregnancy, whether it be like how to care for a newborn on my hands, and I have a lot of joint damage, how to manage the fatigue. So that's why with my involvement with CAPA, the Canadian Arthritis Patient Alliance, I spearheaded the development of resources to kind of help, provide some of that information to people so they wouldn't be struggling to find it on their own. So hopefully it's all together and can, make, hopefully, lessen the stress at the end of the day, or that trepidation that I felt, so hopefully others don't feel the same way that I did.
I agree that when you have JIA, you are resilient and adaptive to so many things, because especially when people can't see your disease, they're even less likely to adapt to the things that you need and to, work around that. So on that note, how does your husband support you and your arthritis?
I mean, he's been great. And I mean, he's always known me with arthritis. So he's kind of always been there from the beginning, Again, I guess another bonus of being diagnosed so young. It's like you find, a partner, or I think there's a higher chance that you'll find a partner that is supportive and understands. So he's been there sort of every step of the way. And, when I get too tired, he would help take over some of the, waking up in the night. Did that a lot, right? So it was very equal, if not maybe more on him, there's no doubt. And yeah, he kind of supplements in, some of the things that maybe I can't do, like kicking around the soccer ball and like those sorts of things. But he sort of takes over some of those things. So I think in the end, it's probably good for kids to see that a parent is not, a perfect, none of us are really perfect. And I think it just kind of shows kids that, you can live with a health condition and still have and do all the things you really want to do in life, and that we're not all the same, that there are a lot of people out there who live with a health condition and maybe, being a little more understanding and empathetic. So I'd like to think that, it can have positive effects.
Is super important, and it's amazing that you found that in your husband and your friends, and I guess like everyone that's around you, there must be super supportive, and that's probably why you keep them there. To talk about Kareen's story as well, because Kareen had asthma, and so I just wanted to know, since that is your story, how did that really affect why you wanted to do research or start patient engagement and shared decision making? Maybe give us a little bit of background of what that is, and then dive into how your story inspired you to start your research.
Yeah, so I think so. It's funny because I think having asthma changed a lot of things in my life, including my career. And I think, as Laurie said, right, she was doing piano. So I was doing a lot of ballet, and I gained a lot of weight when I was in a kind of doing it at a ballet school, and I gained a lot of weight, and I didn't know why until a few years ago. I met with arthritis patients who told me that their body changed completely when they use corticosteroids. And I was like, you know what? It's when I was really sick and I was on corticosteroid for a while that I gained weight. And then after that, for ballet, it wasn't like optimal, right? Because you can get hurt. And it's probably changed my career choice. Anyway, so this is just like one of the things, like, I relate to Laurie so much on so many different levels. So what happened is that for sure I went into like healthcare, potentially because I had asthma, right? So I've seen like physicians and nurses. And so that, really it kind of changed the way I felt about healthcare, and I really wanted to get engaged in healthcare. And I decided to do research like one day when my asthma was so bad. So I was going to an exam in occupational therapy, and I was going to my exam walking, and I was like, I can barely breathe. I was taking like a lot of medication that day, and I was like, so what happened is I was with a dog. I did some volunteering. I slept in a place where there was a dog before me, and I was just so sick. And so I was like, how come I'm not able to breathe right now? Like, how come? Like, what went wrong, right? How come I'm not able to like self-manage? How come I couldn't see this coming, right? And so what happened is that day I was like, okay, I want to do a master's degree. I want to do research. I want to kind of develop like tools to help people self-manage their chronic conditions. Whatever chronic conditions, I think it's all kind of similar, right? It's kind of being in charge of your health, knowing what you can do to prevent like all the episodes, all the problematic stuff that comes from a disease, and being able to really make the best decision for yourself and be in charge. So I realized I wasn't in charge. I didn't really take it, I didn't have, like, if I had a test, like I would have failed that test for managing my asthma. And so that's what started it. So then I decided to go into research. And it's funny because it's only a few years later. So I was doing, my PhD, and then I started to do research. And I was at the postdoc, and some people that I was working with, so there's the group, Peter Tugwell's group in Ottawa, they were building patient decision aids. And I started to hear about patient decision aids and shared decision making. And I was like, what is that? So I looked into what shared decision making is. So it's kind of like a process by which you make a decision with your healthcare providers. The best would be to have many different healthcare providers, right? Like interprofessional healthcare team. That's the best. And so with your healthcare providers, you have to learn about all the different options. So if you have a choice to make, you can't just have one option. Like, oh, your physician tells you, take this medication. That doesn't really help you to inform you, right? So you need to know, like, what are all the options you can use? What are the benefits and the risk? Does that come from scientific evidence, right? You would like to know, is it proven or not? And then you have to really try to understand what is important to you. So, okay, what kind of treatment I prefer, right? Do I prefer, like, for example, a pill to take versus an injection or versus an infusion in the hospital? All these things are different. So you really have to find, like, what you prefer. You have to look at also, like, what are the benefits and the risk that you value most? So, for example, if there's a medication with more risk, but then more chances that it will be more helpful for you, or do you prefer to kind of say, okay, I prefer to have a bit less risk, but even if it works a bit less, like, I'm more comfortable with that, right? So you have to make these decisions yourself, I find. So I think you really need to have information on this. So information on the treatments, then you decide what is truly important to you. And you might need some help with that, right? You might need, like, to talk to healthcare providers or family. And the goal is really you make the best decision for you. So that's kind of how I see shared decision making. And I realized I didn't always do that, with dealing with my condition. And there's a lot of treatment options I didn't even know. And still now I probably don't know many of the treatment options, right? And then patient decision aids are interesting because they can help prepare people to actually make a decision that is the best decision for them, right? So patient decision aid can be kind of printed material, or they could be like videos or web application that are interactive, where you put, like, hey, this is the stuff that I want. This is how my disease is. And then it helps you to make a good decision, not a decision for everybody, a decision that's really good for you personally. So when I learned about that, I was like, oh, okay, that's what I think I would like to have for all my decisions in life, including, like, buying a house and finding a husband. So I make a joke with that, but yeah. So if the decision is not shared with your parents, it could be bad, right? We know that. No. So yeah, that's what kind of, started it. And when I learned about it, I was like, wow, I would really like to develop patient decision aids to really help people make the best decision possible and stick to their treatments, right? Like, if you choose it yourself, then you have more chances of, like, doing it later on.
Yeah. I work as a realtor with my dad, and oftentimes that's what we always say, is that we're not here to tell you what to do, tell you what house to buy. We're here to give you the information so that you can decide what's the right decision for you. And sometimes I feel like doctors don't think that way. They just give you an option, and they say, no, you should do this because I think this will work. But oftentimes we forget that patients do need options, and patients do have to be able to decide what their medication they're on, what therapy they're doing, like, what works for them. So how did you guys actually meet each other?
Lori, let's talk about her story.
I know my first recollections actually of meeting Ketin, they might actually predate yours, because I think it was one of the first research conferences I ever went to for the Canadian Arthritis Network. And I was probably like in my mid to late 20s. And I walked into this room and there were all these posters on the wall. And I think Ketin was at one of these posters presenting. You must have been like a master's student or something then. And I started looking around. I'm like, first of all, I didn't understand the whole poster session thing.
Yeah, I remember some of the meetings of the Canadian Arthritis Network. So it was like a network where really you had researchers, clinicians, and patient partners.
Yeah.
So I think I met Lori, and I remember at some point we were like eating, and it was at the conference, and we were talking. And I just find like it was really nice talking to her, and it was really kind of like it's good to have the patient perspective, and it was so much fun. And we met like every conference, and then at some point I said, "Hey, Lori, do you want to give me advice on my research?" And then she said yes. And we went to eat lunch next to your office building. I remember that.
It's always food. I'm kidding.
It's always food.
It's always food that helps spark friendships. Food for everything, like everything you do. Oh, let's go out, let's eat. But yours is just like a coincidence that it actually happened. You do explain a lot on your YouTube channel. I know you've been to conferences. I'm also on that YouTube channel. But just to give everyone a little bit of background, we will be putting the YouTube channel in our description so everyone can check out Lori Cureen and the Choice Research Lab YouTube channel. But what is the research project that you're currently working on? What was the inspiration behind this project? I know you mentioned shared decision making and all that, but why certainly that project?
So we're working on the project. So it's the JIA option map. So it's a project that started a few years ago. And so what happened is we started to think of the notion of pain in juvenile arthritis. And we kind of realized, and I think Lori was one of the person to say that, and other people told us, well, pain is not really discussed as much as it should. And the different treatments to treat pain and the different treatments in general to treat many different symptoms of juvenile arthritis are not necessarily discussed a lot. So for example, medication is discussed a lot, right? Medication to deal with kind of the inflammation, the disease itself is often discussed more in clinical practice. But like all the other treatments, like, massage, like insoles and, chiropractics, all these other treatments are not necessarily discussed so much with patients. So one of the things we found is that people were using a lot of complementary and alternative medicine and a lot of non-pharmacological options, and they didn't necessarily talk about it with their healthcare providers. And so healthcare providers were like, oh, it's very important to assess that, but we don't know what to say to people, right? We don't know what kind of advice to give them. And so when I learned about patient decision aid, I was like, well, maybe it's good to have a patient decision aid about that, right? There's so many different options. And what can you do for your pain? And so right now we developed the JIA option map. So it's an interactive web application for all the different, like not all the different, but many different options for pain management in juvenile arthritis. So right now there's 39 options, but there could be more, like we could add more. Some of them are like proven, there's some scientific evidence, we show studies, and some of them don't really have a lot of information. So we don't know, we're like, oh, you could potentially use this, but we're not sure. And so what is interesting is that based on where your pain is, based on what you prefer in terms of treatment, it's going to show a few treatment options you could try, and some you could also discuss with your team, with your healthcare team. So it's kind of how it started. And I think Lori would say with the team, with the patient partners, like we kind of modified it over time, right, Lori? Like it's kind of becoming even bigger than we thought at the start.
Yeah, I would think so, and I just think in terms of pain, I guess I've always been really supportive of doing more there because especially looking back, I mean, even as an adult, I feel like there aren't always a lot of solutions offered, yet it's like one of the most like the biggest symptoms that we need to manage like every day. But particularly when I look back to my teenage years, I honestly think some of the worst pain I've ever had, and that's been the most unmanaged in my life, comes from that time. And maybe it's just because you don't have the tools, the vocabulary. Maybe it's like the healthcare providers don't know what to say. So I think that just is why I feel this is just so important and why I've like, aside from Keden being a very lovely person to work with, this project is just so important, I think, from that perspective, and I really look forward to the time when everyone can access this and not feel, so alone. I think living in pain, there's nothing that makes you feel just quite so isolated. And having information sort of helps negate that, I guess, to some degree, right? That you actually have a set of choices that can help you get through the next day.
It is really important. I know when I think I wrote for something. I don't remember what it was specifically. Maybe Lori, remember we wrote some quotes or something. I mentioned how I wish I had this when I was diagnosed because it's so important. I think my parents did so much research that they didn't really need to do that could have been there. They had to do digging through Google to find other treatment options that would work alongside medications. And it was really hard to have those comfortable conversations with your healthcare providers because you're so scared that there are these options that you want to talk about, but you're just scared that maybe like medication's the only thing that'll work. So what are your thoughts on alternative treatments and why have you really focused it on that, knowing that maybe some people might not be open to wanting to have options in their clinics and stuff like that? Why have you gone forth with this?
I think one of the things I could say is we had a lot of pediatric rheumatologists and nurses and physios and OTs who kind of told us like, it's really important to have a lot of choices. It's really important to look at the different options. Some of them may be dangerous and maybe we need to tell people, right? And some of them may potentially help them, right? So it's good to have like all the tools, right, in your toolkit, right? And I think so some of the healthcare providers who work specifically in pain. So I'm thinking, for example, there's the CARA network, which is a big network, North American network of researchers in pediatric rheumatology. So there's a group dedicated to pain. And so some of these pediatric rheumatologists are really trained kind of to deal with pain in JIA. And they already have a list of all the things they can offer their patients, right? So often they're already kind of prepared to discuss these different options. I think maybe not all pediatric rheumatologists or adult rheumatologists are there, right? But I think everybody now realizes how important it is. So I'm thinking, for example, like just look at nutrition, what kind of nutrition you should have in order to kind of optimize your health, and the impact it could have on the arthritis symptoms potentially. I mean, I look at, orthotics, for example. Orthotics is not necessarily always, there's not necessarily a lot of advice on it. Massage, mindfulness, all these things that I think now are more mainstream than they were before, right? I think now everybody's like, if you only talk about medication, you're really missing a big part. So I think there's kind of a common understanding of that.
Yeah, and I might just want to add too. I mean, there has been in the health policy world, there's been a bigger focus too on pain management. So there's the National Pain Task Force, and they've just provided some recommendations. And I think it's just getting increasingly recognized that it's like you need multidisciplinary pain management. You need, things like counseling, things like, like the orthotics. Like it could be a lot of different things. So I think that's probably the most effective way of managing your pain is having many different choices that you can pull together and hopefully find something that works for you. So yeah, I mean, I'm happy to provide more information if your viewers want to see what that report is. It's a topic close to my heart too, because the CAPA president is actually like a member of that task force. So they've included people with lived experience, people who are feeling that pain directly in the work. So, and it's really nice to see a solution that hopefully, or these recommendations, now it's a matter of implementing them now in all the provinces. So.
And even now that we are we're talking about mental health more frequently, and like Natasha and I have discussed it before, that mental health and physical well-being, especially when you have a chronic illness, really play hand in hand. If mentally you're not feeling your best and you're feeling anxious and stressed out, it does end up showing up in your body through your chronic illness. And so discussing that, and sometimes that pain isn't always treatable with your medication, because it's not 100% your condition. So like those things, I feel like they're so important to bring to the forefront, and you guys are doing an amazing job at opening up people to these different treatments that we really do need to talk about and bring forward. All right, so what do you guys hope that rheumatologists and healthcare providers provide for patients that they are not really providing right now?
Yeah, that's a really good question, I would say. Yeah, I guess I really see shared decision making as being like the future. And I guess that's why, even with Kappa, we had Kat in for a webinar with some others. And I'd really like to see that more and more. I think, particularly thinking back to my transition too from pediatrics to, the adult world, realizing that, yeah, I do have some control here, right? That this is my body and I can make these decisions, right? It's a tough, road. I won't, underplay that. But I would really like to see that where it's like patient needs, patient preferences, that involvement in decision making. I really want as many rheumatologists and healthcare professionals to support that, right? And realize that in the end, it's like your body, right? So you've got to be comfortable making decisions about it, whether it's medications or seeking counseling or, trying physiotherapy or whatever it is. So that would be my advice.
Yeah, and I totally agree. And I think that there's many healthcare providers now in rheumatology who really are feeling this way, and that's what they want to. So I think it's just the whole system needs to go towards that, right? Follow this trend. The other thing I would say too is that there's so many different options, but some of these treatment options are expensive, and it's still an issue, right? So some people tell me, oh, I would like to do more massage or more, psychology sessions or things like that, and it's expensive because like your insurance pays a little bit, but not everything. So I still think that there's a big barrier to all these interventions. So maybe just we need to test more of these interventions to really have payers like pay for it, right? Mm-hmm. It's a problem when you have services that you need, but then you don't have access to it.
So Lori, what did you find that was the hardest part of your arthritis journey, and how has this JIA option map really helped you?
In terms of my own, like probably the biggest challenge when I think back was the road to acceptance of what that, I think of particularly when you're diagnosed as a teen and you sort of look around and you're like, wow, I'm like, there's no one like me, right? Everyone is out doing like, everything they want, and you're like struggling with fatigue, and it's just all these things. So I think coming to terms to what arthritis, meant in my life, the impact that it has, and then adapting my expectations was probably the biggest challenge looking back. So ironically, probably like most of my teenage years were probably like the hardest. And I think it's just hard for anyone, right? Like being, that period of growing up, I say, and then you throw a chronic illness into it. And so, but I think the biggest thing I've learned, like just by working with Ketin and even some of the other researchers, is that, patients can have, a seat at the table, right? And so I hope that others like you too, that's why it's so fantastic to see, it's like you're doing this podcast all on your own, like Natasha's involved in research projects and beyond. I think you're involved with PACER, and it's just, yeah, like I'd like to see more of that, and that I think people just need to see that they can make those sort of contributions with their lived experience. Like you don't need to have like a PhD in whatever, or clinical epidemiology, not to, minimize, the education and that, and you need that too. But I really think that. yeah, we should all see a role for ourselves if we want to pursue it as, bringing patient perspectives, those lived, experiences to the table, because I think it's really needed. You'll always find that you're like saying the thing that no one else is saying, and that's exactly why you're there, right? So it's okay to feel like that, and it's just, yeah. So anyways, I think I think that's just been like an amazing experience for me, and I hope to see others come behind me to sort of take on similar roles.
Yeah, I'd say that it's so important. I didn't realize how important patient perspective is and how much it's actually valued. Like Lori's been giving me a lot of things to do recently, and I'm very much enjoying it. It's so inspiring to see that your voice actually matters. Like you don't think it matters, but it actually does. And you can make a big difference by being involved in research projects. And that's why I really like working with you. But that's another story.
I agree 100% with Laurie and Natasha, for the record.
To end us off, we have one last question for both of you. What do you both plan on achieving in the future with arthritis and your research?
I think, continue to work with my amazing patient partners to continue kind of, working on the GIA option map. So we want to add other symptoms like fatigue and also mental health symptoms. Because really, I think a lot of the patient partners and patients that we interviewed really said it was really important, and it's linked to pain often. And so we're going to work on that. We have also some exciting stuff coming because there's a researcher in Sherbrooke who is going to modify the GIA option map to actually have a version for adults with chronic pain, chronic musculoskeletal pain. So the goal is that it could make little babies. So it could make like a lot of other similar tools that would be free and that could be used by people with other chronic conditions. So
your baby could make babies.
Yes, exactly. Exponentially.
Yeah, I like that. Yeah, in terms of my goals, I guess it's funny like this. I like to see more patient leaders in the arthritis world. I would like to see more of us at the table, whether it be with government, whether it be with research, I think we could play a really unique role because like everything affects us, right? Like research does, the way healthcare is delivered does, access to medications, like we feel it all at the end of the day. So I think we could play like this role in between all of that to kind of paint, a better future for people with arthritis. So to me, I would love to see more mentoring happen within the patient community. I'd like to see more patient leaders embedded in all, like, even like, staff and, employees in organizations. Like I want to take it a step farther, right? And see patient leaders, they don't necessarily need to have a PhD in whatever. They bring their PhD in lived experience. And that,
I was going to say that.
So yeah, that's the future I guess I dream of, and I hope that others will sort of want to come along for the ride with me. So
can I add also that like it's important, one of the things we're working on now is it's really important to also compensate patient partners for their work. So I think it's kind of not good to say, okay, you're going to volunteer to do all of this. We're going to take everything you bring us as researchers, and then, we're just, we're not going to compensate you. So I think there's a big conversation to have about that. I think that just to add a bit, like, I think that if I do a research project without patient partners, it's not a good research project. It's not optimal. There's a piece missing. I think that's what like all researchers need to understand. Yeah. And the other thing is there's also a really interesting tool on the Clinical Trials Ontario website. So there's a decision aid to help patients decide if they wish to be a patient partner in a research team. And there's a tool for researchers to decide if they're ready to engage patients, because they need to be ready as well. Because it is like, it's not that easy, and you need to, right, Laurie? We're working on it and we're trying to.
Yeah, no, definitely. There's a lot of great tools out there like that to see whether you're ready. And I think Yeah, that's why I harp a lot on compensation for patient partners, because it's like we'll never find the time in our lives to dedicate to this, right? If we don't recognize people, because the people have lives, and I have a job, like a regular job that pays my medications, right, which are very expensive, and all these things. So that's why I'd like to see it sort of more ingratiated or integrated into how people do things, and seeing us as equal members of the team, right? Because I feel like without a concerted effort to kind of support people, to compensate people, to enable them, I'm not sure we're going to have better outcomes for patients, right? I'm not sure we're going to get there, right, if we don't dedicate the resources, money included. So.
Mhm.
We're so glad that you were able to tell us your journey and make your journey so positive with the help of Corinne as well. And we're so excited to see what is next and yet to come with patients and researchers, as well as this project. Options are so important, and we've really discussed that today. Anyone who is interested in participating as a research participant or being somewhat involved, feel free to message us, and we'll pass your email on to Dr. Corinne Toupin-April and Lori. And thank you so much for both of you for joining us today. Everyone, feel free to download this episode, like, comment, and share it. And we'll see everyone next week on Take a Pain Check. Bye.
Thank you.
I can't hide, 'cause growing pains are keeping me up.